My name is Shannon Halbrook. I'm a fiscal analyst with Every Texan, an independent, nonpartisan research organization that advocates for public policy to help all Texans reach their full potential. Texans of all backgrounds need reliable public health services that protect all of us. The Texas Department of State Health Services is on the front lines protecting our families. Yet low pay, high turnover, and systemic understaffing continue to plague state agencies, costing all of us. Between 2003 and 2023, the state population grew by 38%, while the average state workforce declined by 1%. At DSHS, the average turnover rate has dropped from 21.2 in fiscal year 22 to 18.9 in fiscal 23, but agency turnover remains above the overall state agency average. Every Texan and the Texas State Employees Union surveyed state agency workers from April to June of 2024 and received over 6,500 responses, of which approximately 10% came from DSHS staff. Demographically, the agency is about 57% people of color, while 73% of the agency staff are women. That's about 15% higher than the state agency average. Our survey results show persistent staff concern at the agency about prolonged understaffing and low pay driving high turnover, severely challenging the provision of high-quality public health services to everyday Texans. I'm just going to read a few summary statistics from the survey. 56% of respondents indicated that historically staffing levels have not kept up with their workload, and 73% indicated that their workload has increased. We asked survey respondents what the two primary reasons employees leave their workplace, and 82% indicated low pay, followed by a lack of advancement opportunities. 65% of the workforce has considered leaving their position for reasons other than retirement, and of those, 57% indicated their decision is driven by low pay, followed by unmanageable workloads. 64% of the DSHS workforce received a 5% pay increase last year, indicating that the majority of DSHS staff received no more than the minimum mandated increase. 38% indicated they're grateful for the 5% raise, but will most likely need to leave their job for a higher paying job. And 22% indicated that the 5% pay raise did not improve their job satisfaction. Overall, DSHS staff indicated that pay increase is their top priority, followed closely by an increase in agency staffing levels to more fairly distribute work and reduce stress. And I'm just going to read a couple of the free responses that we got from staffers at DSHS. The first one is by a treatment plan coordinator who said, "We can't retain people because the pay is not realistic. Working for the state used to mean something, but we are far behind the times. People rather have one job they care about than having to have 2 or 3 jobs to make ends meet." And then the second quote is from a public health worker, staff at the agency. "If we cannot recruit young people to join our team, the public health division will not continue to function well in the future. It really is time for the legislature to take a hard look at this." So staff levels at state agencies are too low because the legislature has failed to prioritize our state workers. Our survey underscores this urgent need. The legislature must raise wages for state employees and provide more funding for adequate staffing. Every Texan requests a $10,000 across-the-board raise for all state employees in order to address long-standing state workforce wage stagnation. Thank you for your time and the opportunity to testify today.
Mr. Halbrook.